This is Dr. Swapna Athavle, plastic and aesthetic surgeon from Pune. Today we are going to discuss about very common surgery in plastic surgery as rhinoplasty. So what is rhinoplasty? Rhinoplasty is correcting your size and shape of nose by minimal aesthetic surgical procedure. This is called as rhinoplasty. So what are the indications for this surgery? Why patients do come to plastic surgeons to get corrected their crooked nose or to make their nose hump less in size, or to correct their shape of ala, to correct the shape of nostrils, to correct the size of their nose, or to improve the size of dorsum of nose. So these are the most common indications where patients opt for rhinoplasty. Then we need to understand what is the difference between septoplasty and rhinoplasty, which is most commonly done together with rhinoplasty. So septoplasty is a surgery where patients do complain of difficulty in breathing, there is sinus problem, the recurrent attacks of sneezing, the blockages of nose when one of the nostril is constantly blocked because of hypertrophy inside your nose. So difficulty in breathing through nose is most common symptom where patients do present to us for deviated nasal septum. So for correction of this deviated nasal septum, we need to correct the deviation from inside. Sometimes we harvest this septal cartilage and we put a spreader graft to make your dorsum more spacious and more prominent. So septorhinoplasty is most of the time we combine. So this is one of the indication when your deviated nasal septum, which is causing your nose deviated towards one side, or the dorsum of nose or the point of nose, most prominent point of nose getting deviated to one side, we need to correct it by doing correction of septum. So septorhinoplasty is one of the indication where most common patients do opt for rhinoplasty surgery. Another commonest indication is they want to make their nose more prominent. Then how can we make this nose more prominent? Either by harvesting your own tissue, that is from costal cartilage or rib cartilage, or from back of the ear we can take small chunk of cartilage and make your nose more straight and more prominent. Another simple way of doing it is putting a nasal implant, which is a L-shaped silicone implant, which we commonly use for rhinoplasty. Other indications for doing this surgery is to correct the nose bones which are on both the sides of nose. We need to break this bone to make it more prominent, and the same time we can use implant or cartilage to make your nose looking much better. At the same time we can correct the shape of your nostrils, the shape of your ala cartilage, and the shape of your the prominence of your nose. So all these are indications of rhinoplasty, which is a layman's term, it is called as nose job. And this surgery is when patient needs to get admitted for a day. We need to pack the nose post-operatively to keep this pack for a day or two. And then what is the downtime of this surgery? When patient can start working? Usually all our patients start working in a week or two. Mostly this facial swelling which comes after rhinoplasty surgery goes down in 2 or 3 days time, and we put a small nasal slab, or what we call is that the implant, which we take external nasal implant, which we take out on 3rd or 4th post-operative day, and patient can resume to work within a week time. So this is all about rhinoplasty surgery, usually done under general anesthesia. 1 or 2 days of admission is required for this surgery, and the surgery is very safe in safe hands. So this is all about rhinoplasty. Thank you.